Hello, I am Dr. Debashish Danda, Professor of Rheumatology, Christian Medical College, Vellore. I'm happy to uh, observe the World Sjogrens Day along with the Sjogrens patient group in India, led by Mrs. Kirtida Oja. So I have been asked to talk about past, present, and future of Sjogren's syndrome in India. There are a lot of common myths and pearls about primary Sjogren syndrome. First of all, it's not Sjogren. Correct pronunciation is Sjogren's because in German, SJ is pronounced as SH. The first three important myths of the three important myths. The first one is people think it's essentially a dry eye, dry mouth syndrome. But the pearl is it is a multi-system disease. Myth 2 is Zika symptoms are presenting complaints in all patients. The pearl is majority do not volunteer of Zika symptoms. And myth 3 is it's rare in India. And actually speaking, the primary Sjogren's syndrome is grossly missed diagnosis by many doctors. That is because the image of Sjogren's syndrome in our mind is like this picture here, a completely dry tongue, almost half the teeth are gone, and a big parotid gland. But this is because of a knowledge bias in Sjogren's syndrome amongst rheumatologists, as most of the published and cited literature in primary Sjogren's syndrome is from the West, largely derived from Caucasian population, and overall understanding of primary Sjogren's syndrome in India is that of the picture below. It is in our mind. So this is not the prototype of the Sjogren syndrome in India. Time has changed. Like in rheumatoid arthritis, you don't wait for swan neck, boutonniere deformity in hands to call it RA, or a bamboo spine in X-ray to call it ankylosing spondylitis. Similarly, you don't wait for a parotid enlargement or very severe dry eye and dry mouth to call someone as Sjogren syndrome. As early as 2003, this was a series came from in northern India where they described the Sjogren's was very rare in the tertiary care center in northern India. The similar, almost the same year, 2003, the series came from southern India, and they also reported a very small number of patients as a series from southern India. So is really Sjogren syndrome rare in India? In 2005 in Iracon, Hyderabad, I presented for the first time 126 patient series of primary Sjogren syndrome. And as expected, the critics, the characteristic of argumentative Indians, raised their eyebrows and they have stormed me with so many questions. Are they all secondary? Indians RA patient may have a secondary Sjogren's quite early. These are not primary Sjogren's. And many such experts' comments. In IRACON 2012 in Ahmedabad, when we were asked to present Sjogren's database, Sjogren's data from various zones of India, I presented from Vellore for the first time 332 patient series in collaboration or in support or in with the help of Dr. Sandhya P, a very prominent rheumatologist from Delhi, and we published it finally. We published it in an open journal of rheumatology. It's indexed in PubMed. You can all see it. And imagine it has gone through so many journals because people are very skeptics. Because we ourselves had published in a textbook by Robert Fox along with Dr. Mishra and Sapan Pandya. Now, many years back, that Sjogren's is rare in India based on the two series which I have mentioned to you. But this series we have described 332 patients, and there are many features like our patient had younger by age by almost a decade than the Western population. There was no volunteering by the patients of Zika symptoms, although it was there. There's less of Raynaud's, probably because of our climate and skin complexion, and there was lesser lymphoma. In addition, only 1/3 of our patients had multi-system disease, high auto-antibody like Rho and La positivity, and the other systemic complications. But 2/3 of Sjogrens had mild non-multi-system symptoms like very mild Zika symptoms or joint symptoms, etc. So then, after publishing this, we were surprised to get a mail from the Sjogrens Big Data Group. And since then, we are looking, since then, there is no looking backward. I'm sorry about the typo. So, from a journey of disbelief, we came to the reality of Sjogren's syndrome in India. So, Zika symptoms in our other detailed study of 275 patients from Vellore, which was published, we found almost half the patient did not actually complain Sjogren's syndrome when there is a provisional diagnosis was in half the patients, and the Zika was complained in only about 12% of the patients. And PSS was diagnosed best by the rheumatologist as expected in about 64% patients, and ophthalmologists and surgery because of the parotid biopsy could also diagnose with high success rate. The patients do not volunteer Zika symptoms in spite of having it by objective test is the most important message from this series that we have published. So this is something we wanted to convey to each of you, that many of our Sjogrens do not volunteer of Zika symptoms on direct questioning. The Zika symptoms are less in Indian patients as compared to Caucasians. The Big Data Sjogren project, which I have mentioned, is a consortium of, now it is about 12,000 plus patients. At that time, it was 8,310 patients from all the continents and 20 centers. And there was dry eye and dry mouth was, even after objective features, was present in between 75 and 83% of patients. There are more than in 90% of whites and blacks and Hispanics. There's also a prospective study. Objective signs of dryness was present in more than 90% of patients, and telltale features such as dental caries was present in more than 60% patients. However, this series from another center, not in Vellore, has shown that even their patients, 40% of the patients did not complain of Zika symptoms. So why is the Zika symptoms are less commonly volunteered or complained by the patients, Indian patients with PSS? It's possibly because the perception about the illness may not be particularly perturbed by the Zika. Most patients may not be particularly perturbed by Zika in the face of other systemic features, and there is no temporal relationship with Zika. The hormonal relationships is maybe another factor. In Caucasian population, the age of onset is perimenopausal, whereas it is earlier age of disease onset in our patients in India. And maybe our women also in India have a little earlier menopause. The wordings of questions, if you ask them direct question of dry eye, they may not say. If you ask them if there's a grittiness or sandy feeling in the eye, they may say yes. Similarly, on direct questioning of dry mouth, they may deny. But if you say, do you carry water with you? Do you have sticky saliva? Do you have premature loss of teeth and frequent gingivitis and caries teeth? They will say yes. So that is another important way of do not get a positive response by direct questioning. And occult primary Sjogren's is very important. Extra glandular features can sometimes predate occurrence of Zika symptoms. So this is also important. And association of Zika symptoms. In Zika cohort, The dry eye symptoms did not show a significant association with presence of lymphocytic infiltration in the biopsy of the minor salivary glands. And there was no association also with anti-SSA or Rho or anti-SSB or La antibody and ocular signs. So the symptoms did not correlate very well with the pathological or more objective features. So to diagnose primary Sjogrens early, the patients do not volunteer Zika symptoms. Negative response even on enquiry may be there, and telltale features like caries, long-standing, non-deforming inflammatory polyarthritis may be clues. Primary Sjogren's syndrome often are misdiagnosed as rheumatoid or lupus or a mild lupus. Zika features may not be obvious in them, or they are not inquired about properly by indirect questioning, which I have mentioned. And all ANA positives are not lupus, like all rheumatoid factor positive people are not rheumatoid arthritis. We have to also apply the exclusion criteria, rule out hepatitis C, sarcoidosis, IgG4 related disease, etc., before diagnosing Sjogren's syndrome. Predominant systemic features are important in lupus and systemic vasculitis, whereas in Sjogren's, there may be subtle signs and symptoms. So, in India, the Sjogren's syndrome has a younger age of onset, at least by a decade compared to Western population. The commonest initial presentation may be musculoskeletal, like aches and pains. Zika is rarely the presenting feature, especially by direct volunteering by the patient, though it may be objectively present in the majority. The very varied presentations and hence delayed diagnosis is therefore likely in Sjogren's syndrome. Low prevalence of Raynaud's, cryoglobulinemia, and hyperglobulinemia are other features of primary Sjogren's syndrome in India. Seropositivity has a good association with major systemic features and milder forms, which are usually seronegative. So SSA, SSB positivity or rheumatoid ANA positivity may be more associated with those Sjogren's patients with major systemic features involving major organs. Whereas in the minor symptoms like Zika or joint symptoms or aches or pains, they may usually be seronegative. And most patients do well with hydroxychloroquine and methotrexate alone, unless there are multi-system involvement. So Sjogren's big data group, when we have been involved with them, we have found that it is the better awareness which is more important. The newer diagnostic and classification criteria are coming, and newer disease assessment tools are also coming, like ESS DAI and ESS PRI, which patients can also report, ESS PRI. The newer drugs, including many biologics, are also coming up in Sjogren's syndrome management. And overall, the outcome is expected to be better over the years. So, all of you know this lady, and why I'm showing this picture? This is because she suffers from Sjogren's syndrome. So, it doesn't spare even the top sports stars or celebrity or anyone. Thank you very much for patient hearing.